At West Virginia University and the WVU Heart and Vascular Institute, surgeons applied innovative techniques to perform a complex reconstruction of the trachea, or windpipe, using a forearm flap to save the life of a 66-year-old man with a large tumor obstructing his airway. The patient had a rare tracheal tumor, 10 centimeters in length, that was severely hindering his ability to breathe. Essentially, he felt like he was breathing through a straw. Dr. Alpert Toker, professor and interim chief of thoracic surgery at West Virginia University and the WVU Heart and Vascular Institute, and a team of others came together to strategize the best way to remove this tumor and give the patient his quality of life back. Due to length of the tumor, a creative option was necessary. The surgical team implanted cadaveric rib cartilage in the patient's left forearm, and after 2 weeks of vascular incorporation, the surgical team utilized this as a free flap to mimic the structured support of the tracheal rings. Surgeons first harvested the left internal thoracic artery and placed the patient on cardiopulmonary bypass. They dissected out the heart and great vessels, then divided and moved the superior vena cava anteriorly to expose the tumor, which was located below the aortic arch. Then, surgeons resected the tumor and mobilized the ends of the trachea in order to connect the posterior or membranous portion. As the cardiothoracic team was operating, surgeons harvested a roughly 3 by 6 centimeter portion of skin, fascia, and muscle of the forearm flap, including arteries and veins. After trachea reconstruction posteriorly, the anterior defect was closed with the forearm flap, skin side down. The forearm artery and vein were then revascularized. The artery was connected to the left internal thoracic artery and the vein direction to the patient's right atrium. The operation was performed on cardiopulmonary bypass to support the heart and lungs, but without stopping the heart. Finally, the superior vena cava was re-anastomosed and the patient was weaned off cardiopulmonary bypass and decannulated. West Virginia University and WVU Heart and Vascular Institute are proud to have such a dedicated and experienced team of specialists from cardiac surgery, thoracic surgery, ENT, and anesthesiology coming together for this first-of-its-kind surgery to restore this patient's quality of life and his ability to breathe again.